I'm Emily Day, and I work in the NICU with Elise and Lindsay, and unfortunately I cannot be there today for our presentation, but I videotaped myself so that I can be a representative of our group and present the research to you. I am specifically going to go through the 3 articles that we used in our lit review, and hopefully through video I can communicate them clearly, and any questions that you have can be addressed with Lindsay and Elise. So thank you so much for listening, and again, I'm sorry I can't be there in person. So the first article that I am going to go over with you is a Cochrane Database Systematic Review article, and it is titled Sucrose for Analgesia in Newborn Infants Undergoing Painful Procedures. This article is a high-quality evidence level 1 article. It is a meta-analysis, and Cochrane databases take relevant articles and they put them together in a big meta-analysis to give us the results of all relevant research. So the sample size is large and adequate. The participants were randomized in each specific article that was included. There was intervention and control groups analyzed, and an adequate description of what articles Cochrane would include in this meta-analysis and what articles they wouldn't include. The results are clear, as well as the analysis, limitations, and conclusions are well discussed. And the conclusion of this article is that sucrose is a safe and effective way to treat procedural pain in the neonatal population. Questions that the article discusses as limitations is what is the optimal dose of sucrose, and what is the adequate numbers and safe numbers of repeat administrations that we don't know, and that the article, the meta-analysis, was unable to determine. The study was sucrose versus water, sucrose versus pacifier, sucrose versus positioning, and sucrose versus control, which was no intervention. So sucrose is clearly a good way to treat procedural pain in neonates. How this article is specifically weak to us here at CHOP is that it's not a NICU population, it is not sick infants, and it doesn't address the preterm population. And then another thing that the article does raise is what are the long-term effects of sucrose in this population, especially if we're a NICU preterm population that's even more vulnerable. What kind of long-term neurodevelopmental effects will this sucrose have? So that's something that could be continued to research in the future. The next article that I am presenting to you is from Pediatrics, the official journal of the American Academy of Pediatrics. It is titled Breast Milk and Glucose for Pain Relief in Preterm Infants. This article is a randomized control trial. It is a high-quality evidence level 1 article. The setting is a neonatal unit in inpatient hospital. The sample size is 88. So a larger sample size is always better, but it is an adequate sample size for the results and the study that was done here. Participants were randomized. There was an intervention and a control group, and adequate explanation of who was in the study and who was not in the study. The results and the analysis were clearly represented, and the conclusion and the limitations were discussed. The summary of this article is that sucrose is a better procedural pain intervention than is expressed breast milk. So that to us means that administering expressed breast milk for procedural pain is going to be more effective than breast milk. However, breast milk is still better than a placebo. And things that the article represents as limitations is what is the best volume of breast milk, the best administration time, does it need to be weight-based, the volume, and how many times can we repeat that? So those are things that we don't know that could possibly improve expressed breast milk as a treatment. The reason why this article is particularly important to our research is because Although it's not the early preterms, it does include late preterms in the population, which is more relevant to us. However, it's still not a NICU population, it's a healthy neonatal population. But the results are applicable to our unit and can use further research and exploration to further define and improve our methods of treating procedural pain. And lastly, our third article is another Cochrane Database Systematic Review article. This one is titled Breastfeeding or Breast Milk for Procedural Pain in Neonates. And this meta-analysis got right to the heart of our issue. Like I explained before, the meta-analysis is a lot of other articles put into one article. It's mostly an inpatient population, and it's full-term neonates. There is some articles that included late-term neonates, late-term preemies, and the sample size is very large. So participants in the articles were randomized. There was an intervention and control groups. The collection of what articles were included and what articles weren't included were very clear. Results and analysis provided, and the conclusion and limitations were well defined within the article. The summary of this article is a nice simple flow. Breastfeeding is the absolute best way to treat procedural pain. It's not specifically the breast milk, it's just the whole breastfeeding process, the sucking, the holding. Everything about breastfeeding is the most effective way to treat procedural pain. If mom's available, if baby can breastfeed, and it's appropriate during the procedure, then that's the number one option. However, in the NICU, that's not always the situation we find ourselves in. The next most effective treatment is the sucrose, and then followed by the breast milk. Breast milk is better than the placebo, it is better than positioning, it is better than a pacifier, but it is not better than the oral sucrose. Oral sucrose is better. The limitations of the study being, again, that the breast milk wasn't studied in combination with other things. What if you do breast milk and a passy breast milk and repositioning breast milk and holding? Then maybe the breast milk would be more effective. But as of now, sucrose is more effective than the express breast milk. And also, again, what is the proper dosage for breast milk, repeat administrations, timing, etc., not defined in this study. And then a weakness of this study for us is that it's not the early preemies and it's not a sick NICU population. So those are our three articles that we used to represent our topic, and we felt are most applicable to what we do here and included the best type of research and the strength of evidence. So thank you so much for listening to me, and I hope you enjoy the rest of our presentation.